Welcome. Today, we're diving into what is, let's be honest, one of the toughest communication stations in the UK MLA OSCE, breaking bad news. We're going to focus on a really specific and tricky one, how to handle a positive hepatitis B result consultation.
This station, it really is a test of everything, isn't it? You've got to have spot-on communication, real empathy, solid clinical knowledge, and know your public health duties. So let's get you ready to absolutely nail it.
Okay, we're going to break this whole consultation down into 6 key stages. We'll go right from the moment you say hello to the final follow-up plan. Stick to this structure and you'll stay on track and hit every single critical point. Simple as that. You know, first impressions count for so much. In that first minute, your job is simple. Build some rapport, check you've got the right patient, and get consent to talk. This sets a calm, professional tone for what's going to be a tough conversation. So here's your opening line. This is perfect. It's polite, it's direct, and it puts you in control of the consultation right away. What's so great about it? Well, you're not just blurting out the results. You're showing the examiner that you need to get the full picture first. That's top-tier medical practice, and it scores big points. Right, your history taking has to be laser-focused. First, check for symptoms. Are they jaundiced, got dark urine, any pain in their upper abdomen? Then, you've got to screen for risk factors. This means asking those sensitive questions about things like tattoos, drug use, or their sexual history. And you have to do it confidently, without any judgment. Lastly, get a feel for their life outside the clinic, their psychosocial context. How are things at home? This tells you who their support system is. Okay, listen up because this is so important. Before you even think about giving the result, you need to know where the patient's head is at. And your go-to tool for this? It's the ICE framework. Ideas, concerns, and expectations. Using this shows the examiner you get patient-centered care. And that's a massive tick in the box. You need to ask these questions straight up. What were you thinking this might be? What's worrying you the most? What were you hoping for today? Their answers are gold. They tell you exactly how to frame the bad news and what parts of the management plan to focus on. And here we are, the moment of truth. This is the most critical part of the whole station. Your delivery has to be clear, direct, and full of compassion. And remember to use a warning shot first. Something simple like, I have your blood test results here, just to give them a second to brace themselves. This phrasing, it's exactly what you should say. No medical jargon. It clearly explains what positive for the hepatitis B surface antigen actually means in plain English. Now, once you've said this, you stop talking. You pause. You let that sink in. That silence is so important. It gives them space to process and shows you're right there with them. Okay, after that pause, you bring in the other results to give them the full picture. You explain that their ALT is up, which means there's some inflammation in the liver, but, and this is a big but, you can also give them a bit of good news. Let them know the other markers look normal. You're framing it for them, yes, this is serious, but right now we're not seeing signs of major liver damage. That can really help calm their initial fears. You can practice this exact case right now and get objective feedback on mymediate.com. So, once they've had a moment with the news, you switch gears. It's time for explanation and management. Your job now is to educate them and lay out a clear plan. You're shifting the conversation from, here's the problem, to, here's what we're going to do about it. First things first, give them a simple definition. They need to know what hepatitis B actually is. Keep it super simple, no complicated terms. A patient who's just gotten bad news needs information that's clear and easy to understand. Next up, you have to tackle the question that's probably screaming in their mind. How on earth did I get this? So you clearly list the ways it spreads. This is so important, not just for them, but because it sets up the next steps for public health and tracing contacts. All right, now you need to explain a really key idea, the difference between an acute and a chronic infection. Tell them that a lot of healthy adults actually clear the virus by themselves, but for some people, it can stick around long term. And the most important thing to say is, right now we don't know which one this is. That manages their expectations and perfectly explains why we need to do more tests. So, what are these next tests? You've got to break it down for them. Explain why you're doing each one. The anti-HBC, that tells us if the infection is new or old. The HBeAg tells us how infectious they are to others. HBV DNA, that's the viral load, how much virus is floating around. And finally, you have to explain that an HIV test is standard procedure for anyone with Hep B, since they can be transmitted in similar ways. Now the conversation takes another turn. We're talking about what the patient has to do, starting today. This part is about their personal responsibilities and also your legal duties as a doctor. It's all about keeping them and the community safe. Your advice here has to be crystal clear. No wiggle room. You need to stop drinking alcohol completely. Don't share razors or toothbrushes. You must use condoms. These aren't suggestions, they're essential rules to keep them and everyone around them safe. And you absolutely have to emphasize that their partners and any close contacts need to get tested and vaccinated. And you have to be upfront about this next part. Hepatitis B is a notifiable disease. It's not a choice, it's the law. When you say, we are legally required to do this, it makes it clear and shows you're following protocol. Of course, you should also reassure them that it's all handled with complete confidentiality. Okay, we're wrapping up the consultation now. To finish strong, you need two things: rock-solid safety netting advice and a concrete follow-up plan. This way, the patient walks out knowing exactly what to look out for and what's coming next. This safety netting advice is absolutely critical. You have to be super specific about the red flags for acute liver failure. Use these exact words and make it clear that if they experience any of these, they need to go straight to A&E. No hesitation. Finally, you lay out the roadmap. Here's what we'll do next. Tell them you're going to repeat their liver tests, get those other blood tests arranged, and refer them to a liver specialist if it turns out to be chronic. And, of course, that you'll help with getting their contacts tested. It gives them a clear step-by-step plan, which can be really reassuring. And your final step is to close with empathy. Acknowledge how overwhelming this is. Saying something like, I know this is a huge amount of information to take in, shows you get it. Hand them a leaflet. They won't remember half of what you said, so this is essential. And always, always end by asking, do you have any questions for me? It's your last chance to make sure everything is clear and that they feel supported. You can practice this exact case now on mymediate.com.